Addiction and mental health disorders often go hand in hand. Many people who struggle with addiction also experience conditions like depression, anxiety, or post-traumatic stress disorder, PTSD. This combination is known as a co-occurring disorder or dual diagnosis. Treating both addiction and mental health together is crucial for a successful recovery, as focusing on one without addressing the other can lead to relapse or worsen symptoms. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our mental wellness hub on the Happy app. Click the links in the description. There is a strong connection between addiction and mental health disorders. For many people, substances are used as a way to self-medicate or cope with difficult emotions. While drugs or alcohol may provide temporary relief, they often make mental health symptoms worse over time. Depression. People with depression may turn to substances to numb feelings of sadness or hopelessness, but substances like alcohol or opioids can worsen depressive symptoms. Over time, this can create a cycle of substance use and deeper depression. Anxiety. Individuals with anxiety disorders might use substances like alcohol, marijuana, or benzodiazepines to manage feelings of panic or constant worry. However, substance use can lead to dependency and worsen anxiety in the long run. PTSD. Many individuals with PTSD use substances to block painful memories or reduce emotional distress. This can temporarily mask symptoms but often leads to addiction, preventing them from fully processing and healing from the trauma. Example, someone with PTSD might drink alcohol to avoid flashbacks or nightmares. While this may offer immediate relief, over time, their drinking can escalate, leading to dependence and worsening PTSD symptoms. When someone is diagnosed with both a substance use disorder and a mental health condition, this is called a dual diagnosis. Treatment for dual diagnosis requires an integrated approach where both the addiction and the mental health disorder are treated simultaneously. Focusing on one without addressing the other can leave the individual vulnerable to relapse. Why integrated treatment is important. Interconnected symptoms. Addiction and mental health disorders feed into each other. Anxiety or depression may trigger substance use, while substance use worsens these mental health conditions. Treating both conditions at once helps break this cycle. Improved outcomes. Studies show that individuals who receive integrated treatment for both addiction and mental health disorders have better long-term outcomes than those who receive treatment for just one condition. Example: a person with anxiety and alcohol dependence would benefit from a treatment plan that addresses both their anxiety and their alcohol use, rather than treating just one. This might involve therapy for anxiety, along with medication or support to reduce alcohol cravings. When treating co-occurring disorders, several evidence-based therapies are effective in managing both addiction and mental health conditions. These therapies focus on helping individuals understand how their mental health and substance use are connected and provide tools to address both. Cognitive behavioral therapy, CBT. How it helps. CBT is effective in treating both addiction and mental health disorders like depression and anxiety. It helps individuals identify negative thought patterns that contribute to both their substance use and mental health symptoms. Through CBT, they learn healthier ways to cope with emotions and manage triggers. Example: a person with depression and addiction may learn to challenge the belief, "I need alcohol to feel better," and replace it with healthier coping mechanisms, like reaching out to a friend or practicing mindfulness. Dialectical behavior therapy. How it helps. DBT is particularly helpful for individuals with addiction and emotional regulation difficulties, often seen in conditions like borderline personality disorder or PTSD. DBT teaches mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness, skills that help individuals manage both their mental health and addiction. Example: Someone struggling with addiction and PTSD might use DBT to manage intense emotional reactions to trauma reminders, reducing their reliance on substances to cope. Trauma-focused therapies. How it helps. For individuals with PTSD and addiction, trauma-focused therapies like eye movement desensitization and reprocessing, EMDR, or trauma-focused CBT address both the traumatic experiences and the addiction. These therapies help individuals process past trauma and reduce the emotional pain that drives substance use. Example: a person who experienced childhood abuse might use EMDR to process their trauma, which can reduce the need to use substances to numb their pain. Medication-assisted treatment. How it helps. For individuals with co-occurring disorders, medications like antidepressants or anti-anxiety medications can help stabilize mental health symptoms. While medications like methadone, buprenorphine, or naltrexone can help manage cravings and prevent relapse. Example: a person with depression and opioid addiction might use antidepressants to improve mood, along with methadone to reduce cravings and withdrawal symptoms. Group therapy. How it helps. Group therapy offers individuals with co-occurring disorders a supportive environment where they can connect with others facing similar struggles. Group therapy provides a space to share experiences, learn from others, and build a network of support. Example: a person with co-occurring anxiety and addiction might attend a dual diagnosis group, where they receive support from peers who understand the unique challenges of managing both conditions. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our mental wellness hub on the Happy app. Click the links in the description. Finally, although this course is free for you, it was not free to get it to you. If I have helped you, all I ask is to think about supporting me with a small donation to my Patreon account or grabbing my Happiness Handbook on Amazon. The links are in the description. Your help allows me to continue creating these courses, reaching others, and spreading the joy in every language.